Welcome to the virtual health talk series at University Hospitals. It's a new series we've started. We used to do community health talks out in the neighborhoods, but in this new era of COVID, we're coming even more remote to you through these virtual series into your homes and computers and giving you the information that you're seeking on healthcare these days. Just a little bit of housekeeping. At the bottom, you'll see a Q&A function. This is where you'll ask your questions of our presenters. We'll save the Q&A section to the end of the talk after the presentations. You may get some of your answers at that time during the presentation, but then at the end, for any other questions, they'll be happy to answer those. Just type them in and we'll ask them accordingly. Also, just to let everyone know, this session is being recorded. Next week, after we get the recording posted on our website, you will receive an email follow-up that will provide you a link to the recording to watch again and or share with friends and family. And you also have the contact information to our presenters if you would like to schedule a plan with them. So today's talk is UH Center for Wellness Weight Loss Support. We're going to introduce you to the series of options, weight loss options at University Hospitals. Our presenters today are all board certified surgeons and all have been fellowship trained in minimally invasive surgery and bariatric surgery. Our first presenter today is Amani Munshi, who will then kick it off to Jacob Petrosky, and Danish Kazi will wrap it up for us today. And with that, without further ado, I'll hand it off to Dr. Amani Munshi. Thank you.
Hi, good afternoon, everybody. Hopefully everybody's having a good afternoon. I am Amani Munshi. I'm one of the bariatric and minimally invasive surgeons here with UH. I have been with UH for over 4.5 years now, and we're happy to bring this session to you in your homes in the comfort and safety of it. And so we'll go ahead and get started on what we're going to talk about today. This is a little brief overview of what our presentation is going to involve. We're going to talk a little bit about obesity and the impact of it. It's something that probably a lot of people don't think about or don't realize to the extent to which it affects the population of all of us in this country and here in Ohio as a whole. We'll talk about our program, our team members, what we have to offer and our locations and how we do it. We're going to talk about a variety of different options that we have for weight loss that we can help you with. And so that's going to include medically supervised weight loss, surgical management, which is what most people think of as bariatric surgery. And then in addition to that, we're also going to talk about newer endoscopic approaches that we have that have become popular more so in the last few years. And so it'll be myself and then my colleagues, Dr. Petrosky and Dr. Kazi, that will be presenting that to us. And then at the end, we'll talk to you a little about how you get started and how you get involved with our program, and we'll take some questions. So, chronicles of weight management. So obviously weight is something that a lot of us struggle with over years on and off, different people in different points in life. And it can be something that gradually comes on, or sometimes for some people it's an injury or something like that that makes them a little bit more sedentary, and then they tend to put the weight on quite quickly. It is difficult to lose weight. It's definitely not an easy task, and that's why we're here to help you with that. It is difficult to lose weight, and then actually keep it off in the long term, and having sustained weight loss is very important as opposed to yo-yoing up and down. We want to try to help you get that slow, sustained weight loss so you can keep it off in the long term. And so what we're going to talk about today is obesity. And so that is when your weight goes beyond a certain point where it is actually a medical condition that doctors and physicians, obviously worry about with other chronic medical issues that can come with it. And so we'll touch on that a little bit. For people that are significantly overweight and obese, just your usual modality of, following a diet you find online or going to the gym and exercising here and there perhaps may not always be enough and may not be sufficient. And so we're here to talk to you about an array of treatments that we have, and most of them are, or rather all of them are FDA approved by our government. So let's define obesity. What is obesity? The way we define it in our medical culture is using the term the BMI, which is your body mass index. It's basically a measure of your height in relationship to your weight. And that gives us the extent of obesity that somebody has given where they are at. Unfortunately, the BMI obviously is not a perfect indicator. For some people, it may not adequately determine exactly, if they're obese, if they have significant amount of extra weight or not, but it is the best indicator that we have, and it's what we use currently. And so if you were to calculate your weight in kilograms and divide it by your weight and height squared in meters, if you are over 25, then that's technically overweight. If it's over 30, then that's technically obese. And we have 3 classes of obesity, with 30 to 35 being 1, class 2 being 35 to 40, and over 40 being class 3. And in case you're ever wondering, you can just go online to Google and just say BMI calculator, or you're more than welcome to go to our website. And there's a nice, easy calculator at the bottom of that page there where you put in your height and your weight, and it tells you what your BMI is. So the impact of obesity is something that a lot of people may not think about. This is a problem that's getting progressively worse in our country for years now. So just to give you an idea, in 1990, the prevalence of obesity in the US was 10%. And now, a few decades later, we are at over 40% in lots of different places. In Ohio, we are the 10th most obese state in the nation as of recently. And in the US population overall, like I said, it's above 40%. In Ohio, it's above 35%. The estimated cost of obesity is hard to get because it affects our health in so many different ways. It's hard to put a number on it at how bad it is. But on average, it's thought to cost $147 billion for the whole country in the year of 2008. That's a fair amount of money, obviously, that we spend treating all these health conditions that we get because of our obesity. People who are obese have higher medical costs, and that has been shown and proven as well. And these chronic medical conditions in Ohio itself are projected to cost $60 billion annually currently and go up to $100 billion by 2023. So that is a fair amount of money that we are spending treating health conditions that we can help prevent by losing weight. Here's a little map that shows you the US of A. This is in 2018. And so Ohio, as you can see, is in the 30 to 35% obesity rate. And obviously there are states in our country that are much worse than that. And so we need to do our best to try to limit that number. Let's talk a little bit about what sort of medical conditions people who are obese get. So the obvious ones that most people think about are your high blood pressure and your diabetes. Those are obviously pretty significant. A lot of people don't pay attention to their blood pressure, but a high blood pressure in the long term can be pretty bad for your body, and it can have a lot of long-term effects. High cholesterol, your high triglycerides, it causes coronary heart disease, requires people to get coronary catheterizations and heart surgery. It also causes a higher rate of having blood clots in your legs, which are called DVTs, and blood clots in your lungs, which are called pulmonary emboli. Diabetes is another big one. Fatty liver is something a lot of people don't think about, but fatty liver also is something that happens as we gain weight, and it can actually contribute to pretty bad health of your liver in the long term if it goes on for a long time. Gallstones is a fairly common one, and among women, infertility and having polycystic ovarian syndrome is another thing that people with significant weight on them can struggle with. Sleep apnea, there's a fair number of people out there that are unfortunately obese or overweight that have sleep apnea, and it goes undiagnosed. That can also be pretty detrimental to your health in the long term and does need to be evaluated and fixed. Pulmonary hypertension and hypoventilation, again, related to your lungs as well. Another common one is arthritis. So knees and hips and joints and back pain and herniated discs, unfortunately, as you can imagine, obviously build on with extra weight that we have. And those are things that can progress as we hold on to that weight for a longer period of time. Cancers, these are ones that people don't think about, but there is data that shows that there's a higher rate of certain cancers, colon, prostate, breast, ovarian, and uterine with people who are significantly overweight or obese. Reflux disease, developing hernias, difficulty with urinary incontinence, depression, and just overall poor quality of life, inability to get out there and spend time with your kids or your grandkids and run around with them, or just enjoy the outdoors in a more comfortable fashion because of the extra weight. And then the last one to touch about for young women out there is the increased risk of complications with pregnancies. So for a woman who's obese during a pregnancy, there is higher risk of having diabetes during that pregnancy. Preeclampsia relates to high blood pressure during a pregnancy, and macrosomia means your baby's come out at a heavier weight. There's a lot of new data coming in that shows the effects of obesity on any man and women, and the way our genetic code is, and how that is actually unfortunately passed along to your kids as well, and puts them at a disadvantage for being obese as well. And so there are obviously a lot of long-term implications from this for yourself and your children. So to talk a little bit about coming to a weight loss clinic, right? So you could say, hey, you know what? I know the things I need to do. I know I need to eat healthy, and I know I need to go out there and exercise. And yes, those are the basis of what you need to, absolutely. But coming into into our clinic for a supervised weight loss program does have quite a few advantages. Dr. Petrosky will be going into that in much more detail shortly. But the advantage is that, we first of all talk to you about the basis that you might already be doing, but we may have a few more tips or tricks that can help you get a little bit more success from doing that. And in addition to that, for people who are significantly overweight and obese, your traditional diet and exercise, unfortunately, is not always enough. And so coming to our medically supervised weight loss program is a seamless and easy way to get yourself into the bariatric program if and when you ever decide that you want to go down that route towards having surgery. And bariatric surgery is, Dr. Kazi is going to be talking about our different bariatric surgical options. It has been shown over years of data that this has been done since the 80s and the 90s, that it does help people lose excess weight and keep it off in the long term. It has been shown to make you live longer. It has been shown to reverse certain illnesses. So diabetes and high blood pressure and fatty liver, reflux disease, your stress on your joints, those are big ones. For a lot of people that have joint trouble, they unfortunately don't qualify for having orthopedic procedures because of their weight. And so coming in and seeing us and helping improve their weight will help them get their other orthopedic procedures. But obviously, ideally, we would like to see you before that so we can never get to that point. And then for certain people who are diabetic with a BMI of just over 30, it is done as a procedure to help with their diabetes and their weight loss as well. And again, Dr. Kazi will probably touch on that a little bit. Overall, this does improve your quality of life. And as I said, it extends your life. And so it's definitely something that's very advantageous for people that are struggling with their weight. So if you're wondering, how does bariatric surgery work? It just staples my stomach and then I eat less? Is that pretty much it? So just to kind of explain that a little bit and give you a little bit more information on why it's useful and why it can help you. So the obvious change is the change in anatomy that everybody can expect. So obviously your stomach is going to be smaller and you're going to eat less food. But there are other things that are going on in the background that you may not realize that also helps you lose that weight. It is a great tool to help you achieve that weight loss. So there are changes in intestinal hormone levels that happen when we do certain surgeries, like your bypass and your sleeve. These change the way that people have had these surgery perceive hunger, and they don't have that same appetite or drive to eat food. These changes also actually change the way your body chooses to use and expend energy. And so the idea is that we're trying to get you to increase how much your body wants to burn, and doing the surgery helps you do that, despite the fact that you're just eating less. Your standard restrictive diet, where you say I'm only going to eat so many calories a day, unfortunately sometimes can drive your body into the state where it uses less and less energy, and it gets harder and harder to lose that weight. And so doing bariatric surgery changes that, and it helps your body lose that weight faster. More than anything else, all of our presenters today will stress on you that surgery is a tool. It only works when it's done in conjunction with very good changes with your diet and your lifestyle. And that's what we're here to do. We're here to help you make those changes and do the surgery for you so that you can successfully get weight loss. Years worth of data from different organizations that study this show that 90% of people are successful with maintaining quite a bit of the weight that they have lost following surgery, and losing, and this is obviously something that you can keep off in the long term with the tools that we give you to help you change your life. So coming to our program here at University Hospitals, what do we have to offer? Well, our program is comprehensive in that we have the whole spectrum of procedures and medically supervised weight loss and surgeries that we can offer. Everybody's different. Everybody feels differently about having something done. And we're here to sit and talk to you about that and help you decide what avenue is best for you. Our dietitians are here to help support you, and we have free nutritional counseling and programs where people come in and help you decide and discuss what your meals are and how much you should and shouldn't be eating. We have support groups as well. Obviously, that's changed a little bit with COVID, but we're still doing that the best we can virtually. There are no fees to our program. We have a team that sits and checks your insurance, and your insurance is covering your surgery, and everything else that we do for you comes as part of that whole package. We have multiple different locations throughout Cleveland. So we have 3 sites where we do surgery and multiple clinic sites throughout the city where we can see you for your pre-op, your post-op, your dietitian visits, and really everything else. Collectively, our surgical team, which is 5 surgeons, we've done thousands of these surgeries, and we're all trained in bariatric surgery. As mentioned, we have 3 locations where we do surgeries: Parma, Cleveland, and Geauga, spread across the city, and then multiple sites of clinic locations where we see you in the office before and after surgery, or for your medically supervised weight loss visits. And so the surgeons that you'll be meeting, they'll be myself, Dr. Munshi, and then Dr. Petrosky and Dr. Kazi you'll be seeing shortly. And then we also have Dr. Abbas and Dr. Keaton as part of our program, and we're here to sort of help you achieve your goals. As mentioned, your team is all these bariatric surgeons. We have advanced care practitioners who are who have additional training in medically supervised weight loss and help you get down that path if that's something you choose to do. We have bariatric nurse coordinators who are very passionate about this. They deal with patients coming in for this day in and day out, and they certainly are just a host of wisdom and additional input that they can give you to help you on this journey. Dietitians, all of our dietitians are bariatric dietitians, and this is exclusively what they do, and they can certainly help you as well. As mentioned, we have insurance navigators that help check your insurance and try to get you on the path where we can get you your procedure covered through your insurance for having surgery with us. And then also dedicated psychological consultants, and that's something that Dr. Kazi and Dr. Petrosky will hit on, as well as steps that you would have to do to get to surgery. And with that, I'm going to give it over to Dr. Petrosky, and he's going to talk to you about medically supervised weight loss treatments.
Hey everybody, hi, my name is Dr. Jake Petrosky, and as Dr. Munshi just handed off, I'm going to go into medical weight loss treatment and medications, and I'm going to answer some questions, talk about how it's different, and we will, let's see, I'm going to share my screen now. I just want to let everyone know I primarily practice out at Geauga Medical Center, which is in Geauga County. It's in Chardon. And I also see consultations and new patients in Geneva, up off of I-90, and I also see patients in Ravenna at Portage. So here we go. I'm going to share my screen, and hopefully everybody can see it, right? All right. Okay. So if you've made it this far and you've been listening, you probably want to know who is a candidate for medical supervised weight loss. And Dr. Ramani touched on some of that with BMI. BMI is not a straightforward number, and it does require a little calculation. But we like to just point out a BMI of 27.5 with weight-related conditions like diabetes, high blood pressure, high cholesterol, sleep apnea, arthritis, back pain, some of the more common health conditions that aren't necessarily life-threatening but do limit our quality of life, do allow us to qualify. Then down here at the next lower corner, BMI of 30 without weight-related illnesses. So that would help someone who's young and healthy and has just slowly put on a little bit of weight over time qualify for medical weight loss treatment as well. I'll save the surgical procedures for Dr. Kazi to go into depth in a little bit, but as I move on, again, BMI, it's real easy to look at someone and say, they're taller than I am. They're probably about 6 feet tall, and that's easy. And then it's really easy to jump on a scale. if you jump on a scale, it's going to tell you right away. It doesn't necessarily tell you what your BMI is or whether or not you can be treated. So I used my slide here that says BMI 27.5 with one weight-related condition, because these weight-related conditions are so common. We're seeing young people in their 20s, early and late 20s, with high blood pressure or high cholesterol, and maybe it runs in the family. And they haven't had any problems with it yet, but you know, maybe they went to see their doctor at age 25 and were told for the first time they have high cholesterol. I've got this slide here where it shows a normal, healthy male that would, you know, would be considered quote unquote normal with a BMI between 19 and 25, who over a couple of years puts on 20 pounds. At 204 pounds and being 6 foot tall, that young man qualifies for medically supervised weight loss. Another example is someone with a height of 5.5 or 5 foot 5 inches, pretty common height for women, and 150 pounds. Still a perfectly healthy weight, still considered normal, but just 15 pounds later, which, you know, that 15 pounds could be potentially baby weight. And it could be brought to her attention that she has prediabetes or high blood pressure. Maybe she learned that after pregnancy. The point of this slide, though, is to let you know that patients with a small increase in their weight over a short period of time, even something as low as 15 to 20 pounds, could be a candidate for weight loss medications. All right. This is kind of the overview. A lot of you know, a lot of us try on our own. Even we're going to try to eat less. We're going to diet. We're going to buy you know, special foods, low sugar, low calorie foods. We're going to increase our exercise, and maybe this is where they come across the information that they might qualify for medications. So what's important about this process? So in order to undergo medically supervised weight loss treatment, you kind of got to be in the right headspace first. And what I mean by headspace or mental space, it's going to be different for everyone. What might turn someone toward the process of weight loss medication is going to be different. So one example, we go back to the baby weight. Maybe it's just need to get a little bit of that extra weight off. It's been hard to get off. We all know metabolism slows down over time. You know, I remember when I was 15 years old, I could eat anything I wanted. When I was 20, I could still eat anything I wanted. Now, you know, since going through residency and training, I've got to be a little bit more mindful. But other things that could cause someone to start thinking about weight loss medication is maybe just not being able to do what they used to do, knowing that they could go up the stairs easily, and now it's a challenge. Now you might feel a little bit winded. Other examples: the start of a new job, maybe a New Year's resolution, or just you know, just meeting a new doctor for the first time, or actually having surgery, and realizing that you know, that hip surgery, that knee surgery that you need or that you just had might have been a little bit easier if you were a few pounds less, and it would have been easier to recover. So these are just some examples of what gets us thinking about how to get our weight back in control. You know, we got to take steps toward good health, which is, you know, goes back to the diet, the exercise, the things that we try to do, try to make good, healthy decisions. We try not to have seconds at dessert, and, you know, just walking more, maybe taking the steps. At university hospitals, we do offer a lot of support services to help you achieve your goals, whether your goals are just 10 or 15 pounds. You know, we have one-on-one support, dietitian support groups. Right now, in the age of COVID-19, we're doing one-on-one virtual telehealth visits. We're doing phone calls for people that don't have the video equipment, or they may not have a smartphone yet. We have an online Facebook group with, you know, people are able to post questions and, you know, go go over solutions and go over potential problems or questions, potential challenges to continue reaching our goals. Another individual that might discover medical weight loss might be someone who's actually just starting the steps for their journey for weight loss surgery. So maybe someone that is interested in weight loss surgery for the multiple benefits Dr. Kazi is going to speak about later. They're going to start with medically supervised weight loss. Many insurance companies do require this. What's different about medically supervised weight loss? It's not a fad. It's not a crash diet. It's not something that you're going to go to the store and you're going to buy in the freezer section. We don't ask you to severely limit your calories and nutritional intake. Essentially, what a lot of commercial diets do is they prescribe a very small amount of food that you can eat. They pretty much tell you can't have anything else without actually providing the education and the benefit for you to learn from. So anybody that goes on a low-calorie diet, they are going to start to lose weight. And we see this all the time. I see patients every single day that come in and tell me, Doc, I was able to lose 80 pounds. It took me no time to lose 50 to 80 pounds. And then after I stopped the diet, I gained it all back. It's because these commercial programs, and I won't name any. I'm not trying to say they're bad. They're actually, some of them are very good, but they don't provide the education that you're going to receive when you start at university hospitals. So we try to teach you about what's in the food. We try to show you what's good and what's bad. And we just try to help you reinforce the things that you're doing well and help you see your victories. One of the things that people are surprised by when they come to see me is they're surprised at the number of options of medications that are available. Right off the top of my head, I could tell you 6 medications that I commonly use for different patients. And I can tell you there's 2 more that I don't commonly use. And I know that the FDA is actually in the process of approving additional very effective medications. So when we start talking about medications for supervised weight loss and for medical weight loss, there are some things that we want to do. We want to make sure that you're safe. So your medically supervised weight loss plan and your program is directed by a physician. Why is this important? This is super important because the number of medications that we take nowadays is actually going up. Usually if you're on a blood pressure medication, you're probably not on just one. You might be on 2 or 3. If you're on a pill for blood sugar, or you're taking a medication for hip pain, joint pain, back pain, you might be on a couple of different medications that can interact with weight loss medications. So your physician will figure out which medications are right for you. We tailor the medication plan to your individual health. Initially, you're going to come back and you're going to see us on a monthly basis until we find a treatment plan that works for you. Very uncommon for medication to not work at all. And if that happens, it doesn't mean that medication isn't a good medication for you. It may mean that alone, it's not a good medication. So what we can do is we can trial a combination of medications and just for a short term, or we can cycle back. Some people want to know how much weight you can lose with medications. And it's actually quite surprising. Every week I'm surprised at how well someone does on one combination of medications when another patient didn't have much effectiveness at all. This last week I had a patient just starting her weight loss treatment with me, and she lost 17 pounds, which isn't typical, not in 1 month, but she's doing it right. She's doing it well. She says she bought herself a tracker for her steps, and she's eating well. So what we do is we talk about the things that she is doing well, and we talk about what our next steps are. The other thing that is really nice about medications is their safety has been vetted, and it has been approved by the FDA. That's our Food and Drug Administration. Some benefits are, we do try to make our program convenient for everyone. As I started my introduction, I see patients at 3 different locations. I know Dr. Amani and Dr. Kazi, they see patients, and then at a couple of different locations, and we still have 2 other surgeons, in addition to our team of advanced practice providers. At the end of the day, though, even if you're seeing a nurse practitioner or a physician assistant, we want you to remember your care is directed by us. I'm going to reinforce here that you are the key to your success. You know, we need to all start thinking of the term obesity as a name of a chronic health condition. Just like weight loss surgery, weight loss medications are not a cure. You know, all of the other lifestyle and behavioral changes are what is going to make the medication and help you get the most out of the medication. And at this point, I'm going to go ahead and pass things off to Dr. Kazi. I'm going to close my screen here. And all right, Dr. Kazi.
Hi, good afternoon, everybody. Let me see if I can share this correctly. Can everybody see my screen? Yep, perfect. All right, so hi everybody, my name is Danish Kazi. I am also a bariatric surgeon trained here at the UH facility itself. 2 of my trainers are actually also my partners, Dr. Ketan and Dr. Abbas, which I will, I guess, introduce a picture of at the end of the show here. I have been in practice since 2009 as a general surgeon. I'm a board certified general surgeon, with my passion being in weight loss surgery as I've kind of gone through my process for general surgery. So I thank Dr. Munshi and Dr. Petrosky, my partners, who are fabulous surgeons, because I've had a chance to, can I see my screen? Okay. Let's see, let me try to fix the screen right here. Are you able to see the screen now?
Let's see. Yes,
Okay.
I'm able to see your screen, Dr. Kazi.
Perfect. So are you able to see this change? Sorry about that, guys.
Perfect.
I tested this. So as I was saying, Dr. Munshi and Dr. Petrosky have operated with both of them, amazing surgeons and fabulously trained, and I'm in awe with their skills. But let's talk about surgery and what we can do when, unfortunately, doing all the right things with healthy food choices, doing the right thing with exercising, following through, being accountable, and even with supervised medical weight loss, when they are not as successful to what you're trying to achieve, the next step will be surgery. And surgery is just like everything else. It's a tool that you can either use it really successfully, or it's just not the right tool for you. So the idea is that it is something that helps you kickstart or light the spark into the fire that's the weight loss, so that you have amazing quality of life and achieve the things that you need to achieve that's individual to you and yourself. So how do we figure out if surgery is right? Well, first things first is you have to look into your heart and say if you're ready to have surgery. When if you do, usually we ask for a referral from a primary care doctor, a doctor you've been following, or even a specialist who recommended that surgery might be an option to get you where you need to go. However, there are some limiters. We follow the rules like everybody else in the nation, and we say, hey, who qualifies for surgery? And yes, the word BMI comes in, and we look at the weight to see who is the best option. And we look at patients who are at the class 2 or class 3, that's the BMI above 35. But have heart that not just medically weight loss supervised with medication, but there are other procedures that are in between with the combination of everything else to help you lose weight. And that's part of that newer fad that they say is endoscopic procedures. I'll touch base with a little bit here, and I'm going to send it to Dr. Munshi in a little bit to talk about the minimally invasive or non-invasive versions of the weight loss. So let's talk about the BMI. So BMI of 35 with any kind of weight-related illnesses such as diabetes, high blood pressure, hypertension, cholesterol, sleep apnea that Dr. Munshi talked about. If those are part with a BMI of 35, you may qualify for surgery, or if you have a BMI above 40. And lastly, it depends on what the insurance qualifies you for, or if you're paying out of pocket. So that being said, what are the types of surgery? Well, before we talk about surgery, you go through evaluation process. Once you get the referral, You go to a bariatric surgeon and a bariatric nurse coordinator who understand what your needs are. We evaluate you both by physical exam, looking at your medical records, talking to all the folks such as the dietitians who evaluate you, and specialists to understand what your needs are and if you qualify for surgery and if you can have surgery safely and if you'll be successful at it. And finally, if needed, a psychiatrist or psychologist to help make sure that you understand the process, if you're ready for it. Any questions or concerns or any underlying issues that have gotten you to where your weight loss is an issue, they will be able to help and maybe guide and help us understand where you're coming from. And again, this is this whole part of this one family, entire one UH, one idea of getting you through a team effort to get your weight loss successfully achieved. So like everybody else in the nation, we do mostly laparoscopic or robotic procedures. I put up open procedures here because we do reserve it for patients who have had a previous surgery or who have a tougher surgery. Laparoscopic surgery as compared to open surgery is a minimally invasive approach with minimal incisions, less than 1 inch in size, about 5 to 6 of them, which allow us to operate quickly, effectively, with reduced wound complications or recovery time. Then, of course, there's also the endoscopic procedures that are coming on board, which mimic laparoscopic or open surgery. They try to achieve the same success rates, but they're not quite there yet. But we do offer the newer procedures as we are at the cutting edge of surgery and what we offer at UH. So the types of surgery that are out there are both restrictive and malabsorptive, and then I categorize the endoscopic, which mimic the two surgeries. So let's talk about the types. Restrictive limits the amount of space in the stomach where you can take in food. In the old days, they had something called the gastric band, which is still some patients have, but UH, we've stopped placing them. What this allowed us to do was place a band in the upper part of the stomach where a port that attaches to this band can be filled with liquid and adjust the narrowing of the stomach. This restriction that was created allows for, when you eat, for food to pass down to the stomach portion and create an early fullness. And because it's narrowed, the food particles go through the stomach slower. So you also have a sensation of fullness and long-term fullness so that you don't feel hungry as quickly. However, it comes with its advantages and disadvantages. The advantage is that it's a short operative time, it's a short hospital stay, and there's really no cutting or rerouting of the stomach intestine needed as compared to the bypass or the sleeve. However, the weight loss is high, but it's slower. The only thing that's to be mindful of is that it does require multiple fillings. It did cause sometimes heartburn or reflux or sometimes even dilation of the esophagus, which is a food pipe that attaches to the stomach. And because it's a foreign object, there's always a potential of it eroding into the stomach lining or slipping and basically failing to achieve what was designed for. That led to higher reoperation rates. And for that reason, in combination of its success rate and because we were removing so many, the group at UH decided to not place any further, similar to the rest of the country. And now we remove more bands than we replace. However, we understand that there are patients out there who have this band who still need follow-up and a good program and to follow along with a good dietitian, a good nurse coordinator, to make sure that if it's working, to be successful at it. If it's not working, then we can readjust it and take it out. And all of us at UH as surgeons are qualified to remove this and potentially offer and talk about revision, which I'll touch base in later, to get you to where you need to go. So the next most common and restrictive, and actually this is taken over as the most common bariatric surgery now, is the sleeve gastrectomy or the banana surgery, as they talk about. This is a surgery that uses a sizing device into the stomach, and then using a specialized stapling device, we cut about 70 to 80% of the stomach out and remove it. How this works is a small food portion comes into the stomach, and because the volume is small, it's about 1 cup size of food that can be tolerated per feeding. That being said, because it's smaller volume, you get less food calorie intake. That coupled with a good program of exercise and mindfulness and following the correct diet of low carbs and high protein, weight loss is achieved. Amazingly enough, because the portion of the stomach is removed, there's some hormonal effects that have been implicated that allow you to feel fuller sooner and stay feeling full for a longer time, which also kicks off the ability to lose weight. However, again, this is a tool which can be driven if you eat incorrectly or not follow the rules. One of the things to be mindful of is that it is because the nutrition is limited, there is a need for a lifetime of vitamins and mineral supplementation. There is also consideration that if you have reflux, this may not be the best surgery for you. And depending on your workup through endoscopy and discussion with the surgeon, it may be either a good option or maybe the bypass might be a better option, or, and that depends on a one-on-one evaluation with your surgeon. Also to be mindful is, as compared to the bypasses, there is no dumping syndrome because the intestine hasn't been rerouted. So it's something to think about. And again, every surgery is different and for every patient. So it's something that we come together as a group discussion to discuss what is the best option for you. That being said, we talk about the second most tried and true procedure, which would be the bypass. It is a combination of restrictive and malabsorptive. What that means is we limit the amount of food that can come into the stomach so that you can feel full sooner, limit the calorie intake, and then also create a situation where the calories that you have taken in don't absorb as quickly. How that's achieved is by cutting the stomach into two portions, a small pouch section, followed by keeping the stomach where we discontinue the bile mixing in with the food. When we discontinue the mixing of the bile and the enzymes with food, the food does not get absorbed through the intestines as easily, and we're able to limit the time the food can be absorbed. That being said, it takes multiple attachments for this to happen. And as compared to the sleeve, there are multiple attachments which make the surgery longer. And there's also potential risks that we discuss as a one-to-one when surgery is the best option. So what we do know is compared to sleeve, the gastric bypass is a more durable surgery. It has been along for a very long time, as Dr. Munchie alluded, and it has a very high success rate. As Dr. Munchie also mentioned, that it has the ability to keep weight down in patients who've had surgery for better than 50 to 70% of the patient population. So the other part is, just like sleeve, you get a rapid weight loss, and it limits the weight-related illnesses, especially diabetes, as we're coming to find out with newer studies. The other part is that we have to be mindful is because we've rerouted the intestines, definitely there's a need for a vitamin and mineral supplementation for a lifetime and a follow-up with blood work. This is absolutely critical because without these nutritional sources, the body can't heal, and in fact, it can set you up for failure to actually gain weight. That being said, we also have to be cautious about your medical issues and history. Folks who are dependent on anti-inflammatory or need chronic medication where the intestines are needed to absorb most of the medication, we have to make a collective decision to see if the bypass is the best option. And what I also think about most importantly to be mindful of is dumping syndrome. I use it as both a positive and a negative reinforcement tool. If you eat a high carb meal or a high sugar meal, the dumping syndrome will create a situation where you get nauseous, sweaty, heart feels like it's jumping out of your chest, or you get palpitations. That is a negative way to say that you ate the wrong thing, and it keeps you mindful of the situation. Then finally, if bypass creates a malabsorption restriction of a certain point, duodenal switch I would call as the extreme of bypass. It creates the combination of both the sleeve and the bypass, where a portion of the stomach is cut so it's shaped like the banana, and the intestines are rerouted where the bile and the food product mixes in a very, very short length of intestine that's left over. Because the intestine is shortened, the advantage is that we get significantly more weight loss to a point where it becomes significant enough to monitor for too much weight loss. And that being said, it is not for everybody. It requires a patient who is very committed to this as a lifelong part of watching your medications, watching your food intake, making sure your multivitamins are always taken. And in fact, it requires more multivitamins and minerals than the bypass does. The part of the side effect of it also is that, unfortunately, because the bile doesn't get enough time to absorb with food, some patients experience a greater amount of loose stools and gas that are foul or odorous, which is treatable. And however, unfortunately, because of the cost of it, sometimes insurance does not cover all of it. Again, this is discussed on a one-on-one basis with your surgeon to see if it's the best option. Finally, the newer things that are out in the area, and to speak about UH as being at the cutting edge of surgery and weight loss options, is endoscopic procedures. These are procedures that allow to mimic the same thing as surgery. However, there's no incision involved. There's minimal downtime, as we appreciate that this does take a portion of your life, and it is quite extensive where you have to worry about pain and how much it affects your life. That being said, let's talk about what options there are. And at this point, I'm going to pass this off to Dr. Munchie, who has placed quite a few number of balloons, and I will allow her expertise to go and talk about this procedure.
Thank you, Dr. Kazi. So just to talk a little bit about the balloon, as Dr. Kazi mentioned, this is one of the options that we have that allows us to help you get an augmented amount of weight loss without doing the surgical procedure. It's what we call an intragastric balloon, which means it's a balloon that sits in your stomach. As you can see in the little pictorial representation here, it's just basically a balloon filled with fluid or with saline. It's placed into your stomach endoscopically, which means we put a scope through your mouth while you're asleep, and it goes down, it sits in your stomach. This is one of the balloons that we have. This is basically collapsed. And so this goes through your mouth and is attached to this tubing. It is put in while you are asleep, and you'll have no idea we're doing it. And once it goes in, we basically inflate it. It gets to the size of a little bit bigger than a baseball. It sits in there for 6 months. This again is done in conjunction with, like anything else, adequate diet and lifestyle modification with eating healthy and being more physically active. This includes coaching with our dietitians. And so basically they talk through about how you're going to change your diet for the 6 months that you have this balloon in, and for another 6 months after it's taken out. The idea with this balloon is it's supposed to help you get to a spot where you understand and learn how to eat better. And so then you continue those healthy habits after the balloon's taken out. It is a great option that sort of bridges between the realm of medically supervised weight loss and losing weight with medications versus the realm of having a surgical procedure done, which obviously requires being in the hospital. So as I mentioned, the advantage of this procedure is that it's done as an outpatient. You come into the hospital, we take you to the endoscopy suite. This goes in, you go home the same day. It is inserted through your mouth and it's inflated. As mentioned here, it's about the size of a grapefruit. You do feel a little full early on. The first few days, you will notice that there's some fullness there, and we give you adequate medication to help you deal with the fullness and a little bit of nausea. But most people in a few short days, in 2 or 3 short days, it's almost like a switch is flipped and they feel better. They're able to start eating healthy, exercising, and the balloon stays in for 6 months, like I said. Most people, in my experience, have lost about 30 to 40 pounds, which is a decent amount of weight. Again, this is looking at people that have a BMI of 30 to 40, so they don't have as much weight to lose as some people with the BMI over 40, and it's a good bridge in between. The idea is that this balloon is supposed to help you feel full faster because it is taking up space in your stomach, and it also reduces how quickly the food empties, so it's going to help you feel full longer. Just to talk a little bit about it, the advantages and disadvantages, as I mentioned, no permanent change in your anatomy. This balloon is coming out when this is all over. It's done as a same-day procedure, and removal as well is done as another same-day procedure where you go home the same day. And it's meant to augment changes that you should be doing, that our dietitians and our staff and our surgeons will help you walk through those changes with your diet and your lifestyle. Things to mention, to be mindful of, as I mentioned early on, people do have some nausea issues that only last for a few days. The weight loss is slower than a surgical procedure, but again, we're talking about people in that middle zone that have maybe 40, 50, 60 pounds to lose and not much more weight to lose. And so they're going to notice the weight loss is not as fast, but it is sustained. Most people lose this weight, learn healthy habits, and keep it off in the long term. Once the balloon is removed, obviously the effects that you were having with it will be gone. So it is learning those important habits that will help you keep the weight off. And so lastly, these procedures are not covered by insurance, and we certainly can talk to you about different options for how to get it paid for if you are interested in this procedure that is, as I mentioned, a bridge between losing weight but doing more than medically supervised weight loss, but perhaps you're not quite ready to commit to surgery. And yes, if you were to try this and you feel like you lost weight, you certainly, in theory, could do it again in case somebody was curious, but most people usually just do it once. And so I'm going to go ahead and give it back to Dr. Kazi, and he will discuss some of our other endoscopic procedures that we have to offer.
Hey guys, are you able to see the screen now?
Yes.
Okay, perfect. So getting back to after the balloon, the next option that's available is something called the endoscopic sleeve gastroplasty. This is the next generation of procedures where endoscopically a lighted camera instrument that's flexible that goes from the mouth into your stomach, and we stitch the walls of the stomach closed together to mimic the sleeve. This is not exactly the same as the sleeve because the 70 to 80% of that stomach is not removed. It's still there. So in a way, it's closed off and it's reduced the volume. However, that effect of the stomach being completely removed from the body is taken out. So it allows for weight loss because there's a smaller volume of calorie that's taken in, but it does not reroute the intestines and does not have that malabsorption portion that bypass has. It mimics similar to what the volume reduction of calories that the sleeve the sleeve itself can offer. The other option that there's now that's been FDA approved and actually is available at UH is something called a gastric irrigation device. It is a unique device that allows for you to eat in a healthy, supervised fashion where you chew your food well and you eat appropriate calories and amounts, but it has the ability to start removing at least 25% of the calories from your stomach through a drain that's placed endoscopically into the stomach and out through your front of your belly. It is a monitored device that allows you to drain in a consistent fashion with a counter that allows you to make sure that you're not overdoing it or underdoing it. And this is also monitored by us in a very supervised fashion to make sure that you have appropriately lost all the calories, following the rules of healthy diet and then exercising. And again, this is on a one-to-one basis to see if this is the right device for you and this is the right process for you. But it is FDA approved and now available as part of the cutting edge weight loss procedures that are offered at UH. To kind of recap of everything we talked about, I'm going to talk about the most common procedures and or surgeries done at UH by all the surgeons. And those three would be the gastric bypass, the sleeve gastrectomy, and the balloon. Dr. Munshi very well capped and summarized everything that goes on with the balloon. It is endoscopic. It's the shortest of all the procedures. It is removable and it has to be removed within 6 months. And it's followed for at least a year with supervised weight loss. That being said, you can lose up to 24% of your excess body weight. Follow that with the sleeve gastrectomy, which is done either laparoscopically, and unfortunately the slide didn't get edited, but we also perform this robotically also, where the procedure is about 1 to 2 hours, sometimes shorter or longer depending on the patient and their difficulty in surgery. The average length of stay is actually 1 day, sometimes 2 days, depending on the need of what the patient requires. You get back to work in about 3 to 4 weeks, ensuring that you're eating right, drinking enough water, following the rules of what you need to take nutritionally, and that you're ready to get back to this, life itself. You can lose quite a bit of weight with the sleeve gastrectomy, up to 50 to 70% of excess body weight. It is a permanent procedure, it is not reversible. So that is something to consider as you sit down with the surgeon and the team. The next most common is the gastric bypass, which is also done laparoscopically and robotically. The length of procedure is longer because there's more work that's required for the gastric bypass. Because there's multiple connections, we keep the patient usually at least 2 days, where we monitor how you're doing with food and make sure that there's no issues such as leaks or difficulty in eating, or if you need more fluids. before you leave the hospital, we make sure that you understand what your next steps will be. You return to work similarly to 3 to 4 weeks. Your weight loss is almost 50 to 75% in 1 year's time. And again, to consider is the dumping syndrome. Finally, as we had touched base before, just because you had surgery, sometimes it's not as successful. What we also offer at university hospitals is that if you've had these surgeries, certainly you can come in, have it evaluated to make sure that if this is an issue with the anatomy, or if it's an issue with the right diet choices, or if it's a combination of having to have a program and the anatomy and a successful program to make sure that you're accountable for your successes and failures. So again, this is part of that one team approach to make sure you have everything you need. And we do it as a one-on-one discussion to see what the next step will be for you guys. So finally, what is the next step? And I'm going to reiterate, all of us are available through, if you're interested, to go to the website at www.uhhospitals.org/weight loss. If you're interested, you watch a short video and then fill out a form. That form and information allows our folks at the back of the scene to make sure that you can get an appointment, make sure your insurance qualifies you, or you understand what the process is both financially and the next step through the nurse coordinator on who you're going to see. And finally, we've recently launched a Facebook page with Dr. Petrosky, Dr. Munchie, and I look over, where if you have questions, concerns, or want to post something interesting or discuss something about bariatric or weight loss, we certainly are willing to place that up there or talk more about it in an open forum. And then finally, as COVID decreases and as we are able to reintroduce one-on-one basis seminars, we will start allowing patients to come in and have a one-on-one group discussion about surgery and options. Again, our office will contact you on what the best options are. Well, the phone number is 440-435-3501 if you have any questions, and I'll bring this slide back up. And then finally, a word about safety. All the surgeons here, everybody in the hospital, all personnel are concerned about your safety. Bariatric surgery is not a simple surgery. It's a complex surgery that requires that we have lots of parts that are moving. To make sure that we do this well, all of our hospitals are independently certified as centers of excellence with all the staff that take care of our patients, that they are well trained in how to take care of these patients, because this is a special type of surgery. All the surgeons are board certified general surgeons that they had mentioned before. We're all highly trained experts in our field who have particularly taken time to be bariatric surgeons themselves. Some of us teach at a national conference level. All of us hold either instructor or faculty position at Case Western University School of Medicine and help teach the residents there. We also make sure that every patient has a complete pre-surgical evaluation to make sure surgery is right for you. And finally, we offer the new COVID testing to make sure that if you have surgery procedures required, that we follow the guidelines and you're tested for it. And this is our team here with Dr. Ketan, Dr. Abbas that we had mentioned that were in the first pictures, and then of course Dr. Petrosky, Munchie, and I. Thanks again, and if any questions, we'd love to answer that.
Thank you very much, doctors. We'll get to a couple questions here that came through. One that came through before the talk, the person asked, I've had Nissan fundoplasty and I'm wondering if weight loss surgery is an option for me.
Yes, absolutely. So even if you've had a Nissen fundoplication, we certainly can evaluate you for a surgical procedure. That definitely would not be a contraindication. So if you want to come and chat with us, with any one of us, we'd be happy to do so.
Our next question is, do blood pressure medications cause weight gain?
I'll take that one. And I'm going to say, you know, I've heard this many times, and, you know, to the effect that it would slow down our metabolism. The answer is no, but we do hear that common blood pressure medications like metoprolol can can actually cause weight gain. I'm not sure what the mechanism is, but we do see this fairly commonly, and it's an option to try to get a different medication from one of your primary care providers.
Our next question is, for people on synthetic thyroid for years, would there be interactions with any of your commonly prescribed medications?
I'll go
I
ahead and
can
take
answer
this
that.
one too. It's not one of the initial concerns. With most commonly prescribed medications, there is one specific medication called Saxenda, which there is a relative contraindication. We should not prescribe that medication in patients with a history of thyroid dysfunction, either hyper or hypo, or currently taking medications. So the answer to that is yes, but it's only on a limited basis.
Our next question is, person wants to know if it's good to fast. They've heard both good and bad.
So the key part of the surgery is calorie intake. So if you are a surgical candidate and you've had surgery, the key part is getting enough calories in so your body is not in a starvation phase. So the most efficient and highly calorie dense that's non-fat and non-carb is protein. So that would be the way to take in. So the answer, if you're a bariatric patient, is you're not a person with a normal stomach anatomy anymore. So you have to think differently. Eating is more for survival and for getting enough nutrition in to be able to successfully maintain your health and your body so that it can lose weight as you exercise and make healthy living choices. So the answer is, if you're a bariatric patient, fasting is not a good idea. Consistent eating and making sure you get enough calories that are appropriate is the key part. I'm going to let Dr. Petrosky answer for as far as medical weight loss if you've not had bariatric surgery.
Okay, thanks, Dr. Kazi. The answer to that is also not clear. There are actually clinical trials going on right now with regard to prolonged fasting and intermittent fasting. We know that there are different metabolic profiles and different genetics, and we're all different. So we know that there are some patients that do really well with fasting, but to my knowledge and to my professional experience, I'm going to say that is a pretty limited proportion of the population. It's not bad to fast, but not many of us actually get the same results. We don't get excellent results with fasting.
Next question is, what are your thoughts on testosterone drugs that help support body composition?
I guess we could say I don't know that there is a whole lot of research, and none of these are FDA approved in terms of helping body composition, as the question goes. I think that that's just a vast field with lots of different caveats to it. It's not something that we generally recommend doing. That might be a specific question more for your physician when you meet with them, in terms of what your specific question is about that and why that's something that you're considering.
Yeah, as part of that also is if we're worried about the D3, B6, B12, calcium, zinc, and chromium composition, again, there's part of the nutritional testing, the pre-surgical testing, and your nutritional composition to start with. If those levels are normal, including your testosterone, then the answer is taking more of that medication that's not a supplement is not the appropriate step. But again, using a nutritionist and following a planned laboratory-based evaluation, that would be the next step. So the answer is actually neither good nor bad. It all depends on your body composition. So that requires a workup and testing. So it depends, actually, is the answer.
Next question, can you talk a little bit about creep skin?
Mark, I'm sorry, could you just say that again?
Yeah, the person has had multiple surgeries and they have skin that they can grab and pull, and we just want to see if there's anything they can do about this.
Yeah, so the most important thing that you can do is you can see a physician. It doesn't have to be a bariatric surgeon. It can be your primary care physician, and have them document the skin breakdown issues that you're experiencing. One of the most common indications for excess skin removal or abdominoplasty or breast reduction, or even recently, we've had some experience with the plastic surgeons I work with and collaborate with, being able to approve thigh reduction and lower extremity skin. It's all based upon symptoms that are documented and symptoms that limit quality of life. So if there's free skin that is irritating the lower abdomen, it's causing ulceration, pain, potentially recurrent infections, that's a very big indication, because left untreated, it can lead to major operations and life-threatening infection. Then with regard to the thigh and the lower extremity skin, those sores and ulcers and wounds can also lead to different infections. But from a quality of life standpoint, they severely limit the ability to walk and do exercise and increase activity that these patients want to engage in. They simply cannot. And so I have seen it approved. Everybody's insurance companies are different, and different insurance companies have different requirements and guidelines. But the most important thing is documenting that it is an issue, seeing a physician on a regular basis, and documenting the treatment that you're already using, such as creams and powders.
Great, thank you. And our last question today is, what does the word dumping mean?
Yeah, I can answer that. As I previously said, dumping syndrome is something that happens, especially in bypass, when you have intestinal rerouting. When you have a carbohydrate rich or a high calorie sugar food intake after surgery, because it is able to pull in a lot of liquid, and because the way it's absorbed rapidly, you get a setting symptoms of either sweating that's profuse, palpitations of the chest and heart, feeling faint, weak, or even having diarrhea or nausea, or sometimes even vomiting, to have this situation of everything, quote unquote, dumping out of you. So you feel like you're dumping all that liquid from you. So that's what dumping syndrome in a nutshell means.
Thank you very much for the informative talk today, doctors. I'd like to hand it back to you if you have any closing comments for today.
No, we all look forward to seeing anybody who is interested in joining part of our family and team. If you have questions, we'd love to answer them. Feel free to email us at bariatricsurgery@uhhospitals.org, or visit us at our Facebook site. And I can speak with to you from Dr. Keita and Dr. Abbas's point of view, which are the surgeons who trained me and are the directors and co-director of the program, that you guys are welcome to our program, and we wish to hear from you for any needs and issues that you have.
Absolutely. And I want to just say that coming to see us, that's not a lifelong commitment by any means. Seeing a physician for weight loss or potentially for weight loss surgery can be a scary thing. And what we like to relay, or help you set aside any fears or any nervousness. We're all physicians. We all took the Hippocratic Oath. We swore to help others and to do no harm. And so we're here for information. We are here to provide our professional expertise and help make the most beneficial recommendation for you to help with whatever your weight loss goal is, whether it's surgery or whether it's medications, whether there's an important event coming up, an anniversary. We're here for the short term, but we're also here for the long term.
Yeah, and one more thing, I actually, the Dr. Petrosky touched base on, it is scary and it is very difficult to go through this process, and know that there are quite a few of the staff members who understand what you're going through and are going through a similar process. I will also I'm kind of proud of this situation, as I'll shout out to one of our nurse coordinators, Anna Hasnekis. She, if you guys may or may not know, received as part of the our colleges of American Society of Bariatric and Metabolic Surgeons as the nurse coordinator of the year for the country. So
for the entire country, yeah.
We are very passionate and I think if I feel passionate than Anna, it would be the superstar of passionate about weight loss, if there's anybody out there.
And lastly, just a quick word, this is about coming to make your life healthy, and this is not for you, but also your family, your spouse, your kids, your parents, your siblings. This is something that you can affect change for your whole family and try to get everybody healthy. And that's what we're here to help you do. So thank you everybody for listening in today. Feel free to reach out to us at any point if you have additional questions or want to just come and chat with us at any point in time. As Dr. Petrosky said, there's no commitment necessary. Even just one visit or one conversation is great too.
Again,
Thank you, everyone.
Thank you very much, doctors and
Thank you.
attendees. Thank you very much for coming today. And you will, if in case you jumped in halfway through our talk, you'll be receiving an email with a link to the full talk that you can go back and watch at your own time. And we look forward to seeing you on future health talks. Check out our calendar on uhhospitals.org. Thank you.